Welcome to another lecture of parasitology. Last time we had discussed cestodes, and in cestodes we discussed Taenia species. Today we are going to discuss Echinoccus granulosus, which is also included in cestodes class. By the end of this session, you should be able to describe mode of transmission, life cycle, pathogenesis, and clinical features of Echinococcus granulosus. I will talk about the clinical features of Echinococcus granulosus with special emphasis on hydatid disease, and in the end I'll talk about the laboratory diagnosis of Echinococcus granulosus. So you must be familiar with this classification by now. We are in the Metazoa category. The phylum is Platyhelminths and the class is Cestoda. Cestodes of medical importance. We have discussed Taenia species in detail, Diphyllobothrium latum, and today we are going to discuss Echinococcus granulosus. Geographical distribution of Echinococcus granulosus. Although the hydatid disease is worldwide in distribution, it is most commonly found in those countries where sheep and cattle raising constitutes an important industry, and therefore there is close association between man, sheep, and dog. It is more a disease of temperate climates than of tropical areas. Now let's talk about morphology of Echinococcus granulosus, the forms in which it can exist. So there are three forms, just like Taenia species. There is an adult worm, there is larval form, and there is an ovum or egg form. Now let's first have a look at the adult worm. Now this is the adult worm, and just like in case of Taenia species, there are three main parts: the scolex region, the neck region, and the last part is the strobila part. Now let's first have a look at the scolex region, which is also known as head region. It has got suckers, the rostellum is present, and along with rostellum there are two circular rows of hooks. The neck is short and thick, and if you talk about the segments or the strobila, so there are three segments: the immature segment, the mature segment, and the distal segment is going to be gravid segment. So it is going to produce ova. So it is a small tapeworm. It measures about 3 to 6 millimeters in length, and it is found in carnivore small intestine. Then is the larval form, and it is found in herbivores, and humans are the accidental dead end host. We'll talk about this later on. So the larval form is also known as hydatid cyst. Now this is a hydatid cyst, and we're going to discuss the structure of hydatid cyst in quite detail in a short while. And you can just remember right now that it represents the structure of scolex of the future adult worm. Then is the ovum or egg form. The eggs of Echinococcus granulosus and Taenia species are similar, and therefore you cannot differentiate between these two ova. So there are radial striations with three pair of hooklets inside, and the ovum is brown in color, which means that they are bile stained. Now let's talk about the mode of transmission. The mode of transmission is primarily through eggs in dog feces which are ingested by humans, and this can happen either by direct contact or handling with the infected dogs. Generally, it is acquired in childhood, and the disease can manifest in adult life. Similarly, allowing dog to feed from the same dish or using uncooked vegetables contaminated with infected canine feces. Life cycle of Echinococcus granulosus. So there are two hosts. First is the definitive host, and the carnivores are included in this definitive host category. So we have dog, wolf, and jackal. And if you talk about the herbivores like sheep, cattle, horse, and goat, so they are included in intermediate host. And humans are the accidental dead end host. So I'll let you know what I mean by dead end host. So I think I should explain this over here. Now, if you look at this life cycle, this mostly involves the cycle between herbivores and carnivores. And humans would accidentally ingest these ova, and the hydrated cysts are going to develop inside humans. So the cycle would end up right in humans if the humans are infected. So they are the dead end hosts. Okay, now let's start with the life cycle, which will go about in the carnivores and herbivores. So the first step is that the eggs are passed in stool by the adult worms in carnivores, for example, dog, and these ova are ingested by herbivores, example sheep, and the eggs are going to hatch in the alkaline jejunal juice, and the hexacanth embryo is going to pass into the portal lymphatic system. Then it reaches the various organs. Most commonly, it can go to liver and lungs. So wherever the embryo settles, the hydrated cyst is formed. Now this is the hydrated cyst, and these cysts are ingested by the carnivores, for example dog, when they consume the meat of these herbivores. Now these hydrated cysts can grow to adult worm, and again they can produce ova, which are passed in feces, and the cycle would be repeated between herbivores and carnivores. And again, I'm repeating this, that the humans are the accidental dead end hosts. Okay, so this is the text version. Eggs are passed in stool, taken up by herbivores. The hexacanth embryo is going to pass to the portal lymphatic system, would reach different organs where it is going to form hydrated cysts. These are consumed by the carnivores, and the adult worms are produced in carnivores, and again the eggs are produced, and the cycle would be repeated time and again. Pathogenesis of Echinococcus granulosus. The adult form is not going to produce any disease. However, the larval form is going to produce hydrated disease, and it is actually called as uninocular hydrated disease. Uninocular means it forms one large fluid-filled cyst that contains thousands of individual scolices as well as many daughter cysts within the large cyst. And the development of hydrated cyst in humans is very slow. It can probably take years. Now let's have a look at the evolution of hydrated cyst, or you can say the pathogenesis of this hydrated cyst. So there are two main layers, I would say. The first one is the ectocyst, also known as outer cuticle layer. The inner one is called as inner or germinal layer, also known as endocyst. Okay, the outer cyst, which is the ectocyst, so it is a laminated hyaline membrane, and it has the appearance of white of a hard-boiled egg. The endocyst is going to give rise to brood capsules. So these are the brood capsules, and The scolosuses are present inside these brood capsules, which are the future head of the worm, or you can say the Echinoccus granulosus, and it also secretes hydrated fluid, and it can also form the outer layer, which is the ectocyst. Now, at times, the brood capsules, they can detach themselves from this inner germinal layer, and they can form independent cysts within the mother cyst, and this is called as endogenous daughter cyst. Now the same cyst, if it is outside the mother cyst, and it detaches itself, so it becomes an exogenous daughter cyst. And this is because there is high intracystic pressure that would cause herniation or rupture of both germinal and the laminated layers through some weakened part of the adventitia, and this results in the formation of these exogenous daughter cysts. Okay, then there is a structure which is called as pericyst. Now this pericyst does not form any organic part of the true cyst, but merges gradually into the surrounding healthy tissue, and the parasite derives its nourishment through it. In an old cyst, the pericyst may become calcified, and the parasite within it may die or degenerate owing to lack of nutrition. And how it is formed: whenever the embryo settles, an active cellular reaction occurs, and it consists of mostly the monocytes, giant cells, eosinophils, and finally the cellular reaction gradually disappears, and this is followed by appearance of fibroblasts, and then angiogenesis occur, or formation of new blood vessels, which are ultimately transformed into fibrous tissue. And this fibrous layer around the growing embryo is known as pericyst. So all of this is the pericyst. Okay, so this would also contain hydrated sand, and the hydrated sand is composed of granular deposits, for example, released brood capsule, free scolosuses, probably loose hooklets, and don't forget this stalk, which is arising from the germinal layer, and it is attaching to the brood capsule with lots of scolosuses inside. Composition of hydrated fluid. So it is colorless or pale yellow, and it has lots of salts, by the way: sodium chloride, sodium sulfate, sodium phosphate, and various calcium salts. It is highly antigenic and highly toxic, though it has got a low specific gravity and has slightly acidic pH, which is around 6.7, and it looks like a white of a hard-boiled egg. Okay, the hydrated sand, as I've explained earlier, it has brood capsules, free scolosuses, and loose hooklets. So can you identify what is this? These are hydrated cysts. What are the clinical features of Echinoccus granulosus? So it can produce hydrated disease or echinococcosis, which is defined as infection of humans caused by a larval stage of Echinoccus granulosus. So patient may be asymptomatic, or there may be pressure effects on the surrounding tissues, and they can be involvement of various organs, and mostly liver is affected, followed by lungs. And please remember, if there is a rupture of hydrated cyst as a result of any trauma or surgery, so this can be very life-threatening, as it can cause anaphylactic shock, There can be possible allergic reaction. There is a risk of spreading hydrated sand, which can give rise to new cysts throughout the body. So here you can see that liver is the most affected organ, and the pressure effects may include hepatic pain, abdominal mass, and it may manifest as jaundice. So you may find a scenario where history of palpable mass in the right upper quadrant, and the patient may have signs and symptoms of jaundice. Similarly, in case of lungs, there can be cough, chest pain, and blood in sputum, which is hemoptysis, and then you can see the abdominal, pelvic cavity, kidney, etc. All of these can also have hydrated cysts, and depending upon the site involved, there would be pressure effects. So this is the hydrated cyst inside liver. Laboratory diagnosis of Echinoccus granulosus. The first test is a skin test which is called as Cassoni's test. It is an immediate hypersensitivity type of reaction, and don't worry about this reaction. We are going to teach you in quite detail when we will move on to the immunology section. So this test was introduced by Cassoni in 1911. Intradermal injection of 0.2 ml of a fresh sterile hydrated fluid produces within half an hour, in all positive cases, a large wheal with multiple pseudopodia, and it can fade in an hour. Similarly, sterile normal saline, which is again 0.2 ml, is injected in the other arm, which serves as a control. Hydrated fluid from human cases, either removed by operation or from animals obtained from slaughterhouse, is used as an antigen. It's a sensitive test, but it is not that specific, and it is also obsolete nowadays. Then there are certain serological tests which can be screening and confirmatory. Now again, I would suggest you not to worry about these tests, as we're going to discuss all of the details of this test in the virology section. So for heme agglutination test, just remember for now that we use fresh or formalinized sheep red blood cells which are sensitized with tannic acid, and they are coated with the Echinococcus antigen. Then is the flocculation test, which is of two types: the bentonite flocculation test or the latex test. So the flocculation test is going to use either bentonite particles or the polystyrene latex particles in case of this latex test. So both of these are coated with hydrated cyst fluid as an antigen, and in both of these tests the serum is diluted and it is then mixed with these antigens, and then the floccules is considered as a positive test in case of bentonite flocculation test, and if there is a heavy precipitate, it is taken as a positive test in case of latex test. And confirmatory test is going to involve complement fixation, immunoelectrophoresis, indirect fluorescent antibody test, and the molecular test, which is the PCR. Please note that commonly enzyme-linked immunosorbent assay test for IgG antibodies detection, indirect heme agglutination tests, and latex agglutination tests with crude parasite antigen, either alone or with combination, are used for primary diagnosis of this disease. Then is the radiological examination. This is often helpful in diagnosis of hydrated cysts of lungs and liver. So the saline contents inside the hydrated cyst would make it relatively opaque, and it can cast a characteristic circular shadow with a sharp outline. Now, similarly, in case of the ultrasound abdomen, especially when you're performing whole abdomen ultrasonography, it is useful in locating the site of hydrated cyst of the abdominal organs, and the CT scan is more helpful than MRI scan in the diagnosis of this disease. Similarly, you can go for IV pyelogram if you are suspecting renal hydrated cyst. Exploratory cyst puncture, histopathology of enucleated cyst. Though you can make an accurate diagnosis by getting few ml of hydrated fluid and examining it directly under the microscope for scolices or hooklets, but it is not advised because you can well imagine if there is anaphylactic shock, so the patient may land up into danger. So let's have a quick look at this clinical scenario which I discussed briefly with you. So the 26-year-old farmer presented to the hospital with a history of palpable mass in the right upper quadrant. So this is the liver area, and there is a history of mass, and this is probably due to hydrated cysts. He had also a history of eating along with his dog in his childhood, so there is history of contact. 1 week before admission, his symptoms have become progressively worse, and he also developed symptoms of jaundice. So do you remember I had discussed that in case if the liver is involved, the patient will have pressure effects, and there may be jaundice in such patients. So on performing ultrasound of abdomen, hydrated cysts were found. Now this is very much diagnostic of hydrated disease. Or you can say if the CT scan was performed, hydrated cysts were found, or cysts containing fluid were found. So if the question comes, what is the diagnosis, then you would write echinoccus or hydrated disease. And if you're asked what is the etiological agent, you're going to write down Echinoccus granulosus. So the Echinoccus is a zoonotic disease. What do you mean by zoonotic disease? It is a disease that is transmitted to humans from animals. And please remember, humans are the accidental dead end hosts. The definitive host involves carnivores, and then we have intermediate hosts, which are the herbivores. If you have any questions, you're welcome to ask. Thank you.